You know, we often think strokes only happen to older folks, but the recent deaths of actor Luke Perry and filmmaker John Singleton show that strokes can happen at any age. And here to share why it's so important to know the warning signs, we welcome from the Providence Brain and Spine Institute stroke neurologist Ted Lowenkopf, along with stroke survivor Ryan Bisak. Good to have you both with us.
Good morning.
So Ryan, first of all, you look pretty young here to have had a stroke, but let's start with your story. Tell me what happens. I understand it starts at a bowling alley.
Yeah, I was bowling and I looked up at the scoreboard and felt a little pop in the back of my head and got a headache and had some blurry vision. That continued for about a week, and I went into the ER to get it checked out and was just kind of treated for a headache. Came back for a follow-up, and my primary ordered some scans, and then that was for the next day or the next week. And then that evening, I was laying on the couch, went to sleep, and then woke up, and my kids, Sylvia and Kieran, were upstairs sleeping, and my wife was just about to go to bed, and I went to get up off the couch and fell. I couldn't move the left side of my body.
Oh, wow.
Yeah, so she called 911.
She called 911. I understand, though, that you said it's not a big deal?
I said, oh, no need to call 911. I didn't know what was going on.
Yeah. And so she called 911. The ambulance came.
Yeah.
And then from there, I understand that in order to diagnose you, you kind of worked with doctors in Corvallis versus via Portland, right? I mean, how did that come to be?
Yeah, I guess it's called Telestroke. I only have a small memory of that, but seeing a neurologist on a screen at some point examining me.
Doctor, tell me what he's talking about here.
So he came into the emergency room with his symptoms, and just to kind of highlight, he had a stroke on the right side of his brain, which controls the left side of the body, and often patients with that type of stroke aren't even aware there's anything wrong, as in his case. So the emergency room doctors in Corvallis called our stroke team. Dr. Amit Kansara beamed in, saw him, treated him with a clot-dissolving medication.
This is all not in person. It's
using a robot, kind of a remote telepresence to actually evaluate him, interact with the doctors, look at the films, gave him a clot-dissolving medication, and then arranged for transfer to one of our Portland Providence hospitals, where a wire was taken up into his brain and the clot was pulled out.
This is incredible technology. How long have you been able to do this kind of thing?
The catheters, which pull the clots out, have been around for about 10 or 15 years, but the time window for treating up to 24 hours has only come about in the last year and a half.
Wow. How was your recovery? Do you remember any of that? What the doctor was just talking about?
I do remember that. I remember being prepped for surgery, or for the thrombectomy, and then kind of coming out of it, and I still had kind of weakness on my left side, but returned pretty quickly to kind of full use of my left side of my body.
Here's what I don't understand. You look like a very healthy young person. How does this, let's talk about how it happens in a young person.
So most strokes in younger people are still associated with the traditional risk factors: high blood pressure, smoking, high cholesterol, family history. In his case, unusual for stroke, but not unusual in younger people, he actually tore a blood vessel in his neck, probably in the bowling alley.
Boy, bowling is rough.
It wasn't my best game, that's for sure.
Oh, really?
Yeah.
Use a lighter ball next time. A clot formed here, and then it went downstream and blocked off the artery supplying the front 2/3 of his brain.
Wow. So what do we look for? What are the signs that we look for when it comes to stroke?
So we use an expression, be fast. When you have a stroke, time is brain. B is for balance and coordination. E is for eyes. Does someone have blurred vision or loss of vision in one eye? F is for face. When they smile, do they get a facial droop? A is for arm. When they hold up their arms, does one drop? S is for speech. Is speech slurred, or person can't produce words or understand them? Then T is for time. If you see any of these symptoms, call 911.
Immediately. And do you have people who then think something's wrong and make sure that they speak or raise their hands so they can kind of tell if those symptoms are, if they're getting those symptoms, right?
Yeah, we want people to be aware. That's one of the things we want people to be aware of, are the warning signs and calling 911.
Right.
Sometimes it's not a stroke, but err on the side of safety and leave it to the experts.
And what do we do to prevent a stroke? You said no smoking.
So most important is blood pressure. Blood pressure should generally run less than 130/85. Occasionally it can go higher. If it does, monitor it. Stop smoking, have an active lifestyle and eat a balanced diet, low in saturated fats. And then speak to your doctor as to whether you have any specific risk factors that need special attention.
And how are you doing now, Ryan?
I'm doing well. Returned, I teach at Oregon State. I'm back there full time. I'm feeling good. My energy's back. I'm not so fatigued, and I'm playing music on the weekends as well.
And still bowling?
I'm still bowling, yes.
Hopefully you have better games than you did.
They've been much better.
Oh, good. That's awesome. All right, to find out more on strokes, just head to KATU.com, click on Features, and then on Family Matters, where you'll be able to learn more about preventing strokes, the risk factors, and also the latest treatments. And